Prior to scrubbing into surgery, you should change into clean scrubs that have not been worn outside or around the hospital. Tuck your scrub top into your pants and remove all jewelry on your hands, wrist, and neck. Place a surgery cap on your head. People with facial hair that extends beyond the mask should apply a beard cover. Grab a clean surgical mask and place it on your face. The blue color should be facing outward, and the bendable wire surface should be at the edge of your nose. Tie the top strap to the top of your head and the lower strap behind your neck. Never crisscross the straps of your surgical mask, as this increases the amount of bacteria that can escape the side of your mask. Next, you will open each of these packages while keeping the contents sterile. The gown is removed from its plastic cover, and the cover is disposed of. And then the blue wrap around the gown is gently opened using the corners of the square-shaped wrap. Make sure you do not touch the inside of the square where the gown is. Then you will drop your sterile gloves from the wrapper straight onto your surgical gown. Next, you will perform a sterile scrub to cleanse your hands prior to surgery. Proper technique will be covered in another video. Once scrubbed, your hands must remain up and in front of your body in your sterile zone. Dry your hands by grabbing the sterile towelette. Dry from your fingertips down and never wipe back up. The towel is flipped so that the same surface of the towel is never touched twice. When the opposite hand is dried, the towel is then dropped to the floor. The sterile gown is folded like a book, and you want to open the book out and away from you. Take a step back from the table to avoid contaminating the gown by touching the table when it is unfolded. Your thumbs are placed in the edges of the folded sleeve. Your wrists are then rotated within the sleeves on either end, and the gown is pulled towards your body. At this point, a non-sterile assistant will help you fasten your collar and tie in the bottom of your gown. Your hands should never exit the edges of your sleeves. Your sterile gloves are placed using the edges of your sterile sleeves. The glove wrapper is manipulated open. The glove is placed with the thumb down around the left wrist. The edge of the glove cuff is grasped with the left thumb and index finger through the sleeve. The opposite edge of the cuff is grasped with the right hand through the sleeve and is used to pull the glove over the opening in the left sleeve as the hand slides into the glove. Now that your left hand is gloved, you may grab and manipulate the right glove. Place on the wrist as it was done with the left hand. You can grab that inside cuff, flip it back on your wrist, and then pull the opposite cuff over the opening in the sleeve and the right side as your hand slides into the glove. With your left hand, grab the rope to the left of the card, and with your right hand, pass the card off to a non-sterile assistant. Rotate away from the card. Switch hands and grab the rope. The card will be pulled away from you. You now have 2 sterile ropes to tie yourself in. You are now ready for surgery.